Greetings, friends and followers. This is Nurses Talking. I am Dale Barcy. As always, if you like what you see and hear, subscribe. Leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I am very, very pleased to welcome Dr. Ghada Shahrour out of Jordan. Dr. Shahrour is an associate professor at the Faculty of Nursing at Jordan University of Science and Technology in Jordan, and she specializes in psychiatric mental health nursing. She has also held several administrative positions at Jordan University of Science and Technology, including head of the Department of Community and Mental Health Nursing, Assistant Dean of Student Affairs, manager of her student housing, and manager of the Youth Health Clinic. She's also one of the co-founders of Psychological Sciences Association in Jordan. Professionally, she has made significant contributions to education, research, and leadership, and her scholarly work is widely recognized with numerous publications in reputable international journals focusing on psychiatric and mental health nursing. So welcome, 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 Ghada.
Thank you so much, dear Dale, for this opportunity.
Oh, it is my absolute pleasure to have the opportunity to speak to you. So first of all, why are you a nurse?
Well, if I think about it, I think there is many factors that played into me becoming a nurse. Like looking up into my childhood, I am the middle between my siblings. So my mother, when she used to go out for shopping or going to a wedding, I'm the one who would stay with my siblings to take care of them. So I held that responsibility for many years when I was a child. And I think this is one factor of me being a caring person. And I think many of us nurses have this trait in them that's why they want to go to the nursing field. So this is one thing. Another thing, I guess when I was in the middle and high school, I loved two courses actually, the English and biology. I was fascinated about the human body. So after high school, I got a high score, high GPA, it was 90.2. And
Mm.
at that point, honestly, I didn't know what I wanted to study in the university. So when I did my admission application for universities, I told my family, you do it. I don't know what I want to be. Seriously. Yeah. So my family were writing down the things that may work for me and this kind of stuff. So first, I was entered into the computer science program at Jordan University of Science and Technology. And I stayed there for 1 year. I didn't like it at all. I was doing good, but at the same time, I didn't like programming. It wasn't for me. So I told my father, like, Dad, I want to become a nurse. And he's like, no, because at that time, nursing was not a likable profession, to be
Mm-hmm.
honest with you, in
Yeah.
Jordan. Yeah. So with that behind my father, I went and I applied to transfer to the nursing school and I got accepted. And I told my father, here I got acceptance to be transferred. And he's like, no, Ghada, you will not do it. You're going to stay in the computer science. And I was devastated, at that point.
Mm-hmm.
So with the help of my older sister, we both convinced him that for me to be in the nursing program, and he finally agreed. I think his opposition was that, first of all, because nursing was not a high-ranked profession at that
Yeah.
time. And he
Mm-hmm.
was telling me, I don't want you to work night shifts because our families are very protective in Jordan.
Mm-hmm.
So
Mm-hmm.
that was but finally, he accepted that I go to the nursing school. I was so happy, and I did it.
You know,
Yeah,
that story of parents thinking that nursing is not an adequate profession for their children, I hear echoed around the world. And it makes me wonder why has it taken so long for us to become recognized and to be seen as the valuable part of the healthcare service that we are. Yeah.
yeah, exactly. I think there is a history behind that.
Mm-hmm.
Always nurses were reviewed like they are kind of helping doctors and servants for doctors. And I think that image stayed for too long, and it was passed through generations. And
Uh-huh.
I think one contributing factor as well is us nurses. Like, we need to advocate for our profession, and we need to empower ourselves to be the best profession that we are in, honestly.
Absolutely. I couldn't agree with you more. I couldn't agree with you
Thank you.
more. So you said something earlier that made me wonder. You said you were the middle child, but you were left to you were the one who was expected to take care of your siblings. If you're the middle child, were your siblings boys?
No, both girls and boys. So I
Okay.
had two sisters older than me, and two sisters younger than me, and three brothers younger than me. We are a
Ah.
large family. Yeah,
Large families are good.
yeah.
So, other than the fact that your dad initially opposed you becoming a nurse, what were the challenges for you?
Well, it was very hard to say no to my dad, because we
Mm.
always need to be obedient to our parents,
Yeah,
and follow
yeah.
whatever they tell us. But I was so happy that at the end he said yes. And to be honest with you, after me, he encouraged my younger sister to be a nurse. Seriously, he's like, you need to become a nurse like Ghada. Because after I graduated from my bachelor, I ranked the first among my year, and I was appointed as a clinical instructor. So he was so proud of me. And for this, he wanted my sister to take that legacy further on.
Look at the trail you blazed.
Yes.
So now, so did you always were you always interested in psychiatry and mental health though? Once you got
Yes.
into it? Hmm.
Well, I'm always fascinated about the brain and about psychology, why people think in a certain way, why people behave in a certain way, what emotions play in our life. And when it comes to mental health, this part of nursing, not just nursing, mental health in general, people with mental disorders are always stigmatized. And even the stigma extends to their families, and there is cultural stigma around it, especially when it comes to the Middle East. And we always associate like having a mental disorder. That means the person is having a weak personality, or he's not religious enough, he's not strong enough. And I wanted to erase that idea. And I wanted to really know what causes mental health, like what's the etiology of these disorders. And I wanted also to advocate for these people.
Yeah,
So
yeah,
this
yeah.
was played a big part in why I wanted to become a psychiatric nurse.
Yeah, and I think about that because that stigma, it's something that again, that is something that resonates globally, in every society, no matter how advanced we think we are, in every society there is a stigma towards mental health. I've been thinking about that a lot recently, and I'm thinking that one of the reasons probably is that we speak when we actually speak of mental health. We speak of it in terms of illness. We never speak of mental wellness,
Yes,
you know.
100%. Yes.
And
Yeah.
and and so if we're not speaking of mental wellness, first of all, we're not talking about how to stay mentally well. You
That's
know?
totally true, because
Yeah.
people, when they hear mental health, or they always associate it with mental disorders. But
Mhm.
everyone knows, like, our physical aspect of our body is connected to our mental aspect as well.
Yeah. If someone breaks a bone, we
Yeah,
sympathize and empathize. But if something happens that makes someone even temporarily um, mentally off their game, we kind of look at them as, what's wrong with you? You know?
exactly. And I feel nurses in the general ward, hospital wards, like let's say ICU or medical surgical, if you talk to them about mental health, they're like, huh, it's like a foreign language to them. everybody comes with a pain in their stomach or in their wherever the pain is. They are also, this plays into their mental health as well.
Yes.
So are
Yes.
you dealing with that aspect, their mental health, when you're dealing with their physical symptoms? Unfortunately not. And
Not.
I see many nurses, yeah, they prefer to go to ICU or medical wards because they feel that's what nursing is about. That
Yeah.
mental health is always alienated, like it's like a foreign
Yeah.
word to them,
Yeah.
unfortunately.
Yeah. That's very unfortunate. That's very unfortunate. What do you think you'd like to see change about the way nursing is done in Jordan, if anything?
Well, the most important thing I would say is for nurses to be empowered. And that empowerment should come from within themselves. You know,
Mhm.
I need to be proud of my profession. I am as good as other professions like medicine, like pharmacology, pharmacologists, everybody. And I should not be treated as a second hand
Yeah.
profession.
Yeah. Mm-hmm.
This is very important because I've seen many nurses, they are not advocating for themselves. They are not having a voice. And this is very important for us to really do well in our job. Another thing I would like to see as a change, maybe not just in Jordan, everywhere, is for us as nurses to take care of our physical and mental health because we work long hours, long shifts sometimes. We experience work stress, workload. So we need to be able to adapt to these stressors in a healthy way
Yeah.
because the first and most definition of mental illness is that I'm having accumulative stress that I'm not
Stress.
dealing well with it.
Mm-hmm.
Exactly. Yeah.
Mm-hmm. Mm-hmm. Yes, yes. And you know, you were talking about us not having a voice. Um, Locally and globally, we have not had a voice. And I wonder if that has something to do with the way we educate ourselves as nurses. We educate and kind of inculcate this idea that we are less than and we are the supportive. Our role is, primarily supportive rather than anything else. And so we come up with that idea. Otherwise, I don't see why we are not advocating for ourselves when other parts of the healthcare team do.
Yeah, maybe it starts with the question, why do nurses enter the nursing profession? And I ask my students when I teach them that question, the first class I enter, why you are in the nursing profession? And I get different answers. Some of them will say, well, this is the school I was accepted
Mhm.
to. And I don't like that answer, you know. I'm
Yeah,
like, why you didn't go for your passion or what you want? Sometimes it's because of the salary, you know.
yeah,
And I think the most important thing that it drives our way or our profession is to be motivated about what we are doing, to be passionate about it
yeah,
and like it. And that motivation comes from inside of us, not because
yeah,
of monitoring in because of money or any other factor. And as you mentioned, because we are not educating about ourselves about what is nursing, and we are not involved in policy
yeah,
to make that advocacy. We feel always policy is alienated to us. It's not for us. We are
yeah,
just nurses who need to carry our regular tasks in the hospital, finish our tasks, go home, and that's it.
yeah.
So I hope this would change.
I sincerely hope so. And I believe it will. I believe it will because as I look at younger nurses, I think they're having a different perspective about themselves.
Yeah,
Yeah.
that's right.
I read somewhere that your research focuses on when you're talking about mental health, your research you focus on school bullying.
Yes.
And I wondered what do you see as the connection then between mental health and the bully? Either the person who's the bully or the bullied.
Yes. Well, there is very strong connection between bullying and mental health, as the research indicates that whether being a victim or a perpetrator or both, because sometimes a person can be a bully and a victim at the same time. Um, So bullying can lead to many mental health problems like depression, like anxiety, PTSD, eating disorders like bulimia nervosa, binge eating, and sometimes suicide. And that's what it drove me into studying bullying. When I went back to Jordan, I was wondering, okay, what my research would be on. I need to have a focus research area. And I came while I was reading it through the news about this 8-year-old school child who committed suicide because he was bullied. Yeah, so I looked into the literature and there was nothing made, there is no research about bullying in Jordan. So that's what it drove me. I want to know what is bullying and how it affects our mental health and what we can do about it to prevent further mental health issues in our children. And even this goes on into our adulthood in terms of depression and anxiety, PTSD, and
Yeah,
sometimes it appears in physical symptoms like headache, stomach ache, and this kind of stuff.
yeah, yeah. So I have a question. I saw that and I wondered if your research gave you any indication as to how do we recognize early that someone has a tendency to be a bully? Is there a way?
To be a bully, yes. Sometimes there are certain signs, like you will see that child in the school, he's always having a group of children who fear him. And he's having this gang, and he's always kind of having this high self-esteem. Although research found that both victims and bullies, they both have low self-esteem, and they
Hmm.
both can experience depression. And sometimes depression in bullies can be higher than in those who are victimized. So
Yeah.
yes, we see that person who is a bully usually not doing or performing, not doing well in their schools. Sometimes they are using drugs, they are delinquent, having some behavioral issues. So these are some of the early signs that teachers or school nurses or even administrations of the school can notice in the children.
Yeah, 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 yeah. And it is so important to recognize these things early because as you say, the bully also is a victim very often.
Exactly.
Yeah. You've done so much, Ghada. And I
Thank
wonder,
you.
what would you say is your greatest achievement so far? What gives you the
Well,
most satisfaction?
um, the most satisfaction I get from that, I'm there to listen to people, to help people out, honestly. Like, I know I'm active in doing research. I'm happy. I get so happy when I publish my work, you know, it's so much excitement. But the most thing that satisfies me is when I have a listening ear to those who need it.
Mm.
I think that's what drives the most satisfaction I get in life.
Good, good, excellent, excellent.
Thank you.
I'm wondering though, what advice would you think that you would give to someone who wants to be a nurse?
Well, to be a nurse, make sure that it is the profession that you're passionate about. This is very important. Because if you have the passion, you will have the commitment to do a good job as a nurse. And another thing which is very important is to have very, very good communication skills because we are communicating with people, whether patients, whether nurses, whether administrative. And sometimes the patient doesn't want us only to treat his pain or to give him the medication or to make sure he's comfortable. Sometimes it's the empathy that we display to these patients that matter the most.
Yeah.
Because when I asked, I like to hear from patients and to have reflection on their experiences when they are in the hospital. And the
Mhm.
most memorable ones are those that where they say, oh, this nurse spent time with me, or she was empathetic, or she was very listening. I think having these communication skills not will only benefit us in our work, but also in everyday life
Yeah,
with our families, with our friends, our peers, everywhere.
yeah, yeah, yeah. Absolutely very important. Absolutely very important. Earlier on, you talked about us not caring for ourselves, and so I'm curious, what do you do to care for you?
Well, I try to care for myself as much. I like to walk. Sometimes I go to the gym. Sometimes it's just little things. For example, I like to have a free time just to reflect on my day or to reflect on what I'm doing, who I am as a person. Sometimes a song can change my mind. I feel like I'm really in the mood to hear a certain song or to dance on my own, going out with the friends, having nice dinners, this kind of stuff. Sometimes the little things really matter. And I always say it's very personal. What works for me may not work for other people. So each one of us need to find what makes them happy and mentally well in their life, and just do it. Of course, sleeping well, having good diet, keeping good nutrition is very, very important as well.
Yes, yeah, and you said something just now in that that really resonated to me because it's something that I do and I find to be so freeing. You said to dance on your own. And it's just freeing just to dance without
Exactly. It's releasing that energy. It's like a workout, but in a different way. It's
Yeah,
releasing that energy and makes you like, oh, getting these endorphins on, and it just shifting your mood totally. Because we cannot just work 24 hours. No, we need to have a balance between our work and our
yeah,
other aspects of our life. Yes.
yeah. I love that. I love that. God, I don't know how to thank you for this conversation. It has been really insightful. I've loved it. I've loved it. Thank you so much.
Thank
Is there any last word you'd like to leave with us?
Well, thank you so much for this opportunity. And I just want nurses to be really proud of who they are and always be committed to the profession. Advocate for yourselves and make sure that you always can make a change and that you leave an impact on other people's life, for sure.
Thank you so much for that. On that note, thank you very much indeed.
Thank you. Thank you, dear Deb. It was my pleasure.